Good evening. If you all join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone, and welcome to the December 6, 2021 Board of Aldermen meeting. Start first with minutes of the previous meeting, November 15th, 2021. I'll entertain a motion to approve.
So moved. Second.
We have a motion. It's been seconded. Any corrections, alterations, changes? Hearing and seeing none, will all those in favor please say aye.
Aye.
Those opposed, motion carries. Up next, we are outside the rail, and we have first up Mr. Claudio Forte of Rutland Regional Medical Center to give us an update on the health of the community and recommendations for really how to keep us all healthy and safe. Thank you for being here tonight.
Yeah, thanks for having me. Over the past 2 years, I've had the opportunity and have appreciated the opportunity to give the board and the administration kind of an update on what's going on at the hospital. And unfortunately, after almost 2 years of this, we in Vermont, as you probably very well know, are at the height of the pandemic. And also, equally unfortunately, here in Rutland County, we are having the highest COVID transmission in the entire state of Vermont. So we've been doing a lot at the hospital to try to respond to this. And a couple of things that are going on right now here in the hospital. We have about 20% of our patients are COVID positive patients in the hospital as we speak. And our inpatient capacity, even before we started over the past month getting this big wave of COVID patients, our inpatient capacity has been strained. I think what's happened is ever since the governor lifted restrictions in May, people have felt safe to come back in the water and come back to the hospital, and a lot of them had put off necessary care, and so we're seeing sicker patients and a high volume of patients, and we have been seeing it consistently over the past summer. And we're also struggling with some of the things that every single business and municipality are struggling with is we can't find enough staff, and we're really scrambling and doing a whole host of things to make sure we have enough staff to take care of our community during this critical time. We're not alone. UVM and Dartmouth have also been at capacity. And so when you put all that together, it comes out to a pretty critical situation, especially for critical care beds and ICU beds. There's only a handful of us hospitals that have that level of capacity. And when Dartmouth and UVM are full and Rutland Regional is full, the concerning thing is we have someone that shows up and we don't have the right resources to give them the care that they need. So we've been doing a whole host of things to try to make sure we have that critical capacity at this really high time. We have clinical and administrative leadership teams that are really working around the clock to monitor the bed situation, look at the staffing situation, and to manage patient flow to make sure that we have capacity to take care of you. And we've done a whole host of things to incentivize our staff to pick up extra shifts, to bring in outside traveling nurses. We've actually appealed to the State of Vermont Agency of Human Services, and they've put in a request with FEMA to get us some FEMA staffing resources to help us out at the hospital, which we see over the next month to be a continued critical period. And so now here, one of the messages that we have is to our community. We're asking our community to help us out to preserve our critical hospital capability. And everyone knows the routine, right? We're asking the community to do a couple of things. Number one is if you haven't been vaccinated before or had your booster, now's the time. It's not too late. We ask you to go and talk to your healthcare provider if you have questions about that and your own personal health. The vast majority of people who are in the hospital, and especially in our critical care units with COVID, are the unvaccinated. Second thing we're asking people to do is please wear a mask in public for the next several weeks over the coming holiday period. This isn't going to be forever, but during this period of high transmission, that is a public health measure we can take to help slow the transmission. And then the final thing is practice social distancing. It doesn't say you can't get together with people over the holidays, but be careful about what you're doing. Try to maintain distance. Try to make sure you know who you're congregating with. And if you feel like you have any symptoms, it just feels like the sniffles or a runny nose, get tested. Don't go out in public until you know whether it's COVID or not. This new strain, this Delta strain that is going through, is just so transmissible. The docs at the hospital say that patients come in, they're like, "Doc, I don't know how I picked it up. I have only gone out limited times," and so forth. It is just so much more transmissible. So my intent tonight is to let you know the critical period we're having at your hospital, and to ask for your help in promoting these public health measures and to appeal to our community to help us out. I'm not here tonight to tell you how to do this, right? That's kind of your job. But I will say that we need unity and we need leadership, and for all of us to come together in that message. And I know there's some practical and political considerations around this issue. But the last thing that we need right now in our community is a contentious or divisive situation like we've seen in other communities around these COVID public health measures. And I know all of you here are the true public servants that are in office, coming to these meetings and listening to constituents. So you're here because you want to help the community, and I know we all want the same thing. So I just want to thank you for your help in letting me come before you, let you know what's going on at the hospital, and to help appeal to our community to help us out during this critical time.
Thank you, Claudio. Mayor O'Leary, I believe you had some comments?
I appreciate that, thank you. And I asked if I could go right after Claudio in the theme of unison, because what I want to communicate to the community is that I echo everything that's just been said by Claudio, and stand in lockstep with the strong message that he's sending from the healthcare community, and which I want to send from city government and hopefully from the Board of Aldermen here in my office. Please consider masking up, getting your vaccine, maintaining the social distancing, all the things that have just been said to support our community in doing it together, and our healthcare workers, who my hat's off to all of you folks up there for doing the job that you are doing. However, I did want to mention a couple of things that I have said in public, and I'm going to continue to say. And that is, I oppose a mask mandate. I know that that's going to come up tonight. I do so for the following reasons. I believe that the mask mandate is unenforceable. I believe the mandate will not change behavior. And I think the mandate, as been mentioned before, will create division and not unison, not bring us together. And I think that is something that this community doesn't need right at this moment. And lastly, I do want to mention that I am really disappointed in the state of Vermont that they have punted this down to the local level and made each individual community have this sort of debate. And I just think it's unfair. If they felt that it was so important to have a mandate and have a mask mandate, then they should have done it statewide, and we wouldn't be in the position that we are in right now. But in that vein, I want to let you know that I have been having discussions both with Claudio and with President Whitcomb over the weekend, and he and I would like to offer a resolution as a compromise to this situation here, which I think we can all get behind. I hope we can, and still send that strong message out to the community that we want people to hear and to listen to and adhere to. So at this point, I'm going to turn it over to President Whitcomb for him to read that resolution, and then you can take it from there.
Thank you, Mayor. Thank you very much, Mayor Lair. In front of each of you, you should have a copy of a resolution that is what Mayor Lair just alluded to, and really encompasses, we feel, a lot of what Claudio spoke to as being important to keep our communities safe. So I'd entertain a motion to suspend the rules.
Motion to suspend the rule.
Second? Okay, so I have a motion, it's been seconded. Would all those in favor of suspending the rules, please say aye.
Aye.
Those opposed, motion carries. So I'll read off this resolution, everyone. Whereas COVID-19 and associated strains are increasingly prevalent in Rutland County region and in Vermont, whereas positivity rate in our region is increasing, whereas our healthcare providers continue to be on the front line facing off against a stubborn pandemic, whereas the current healthcare system is strained by increasing need for patient care of all kinds, whereas it is our obligation to support and help protect the system of care that is available to all residents, whereas without remediation efforts on the parts of all citizens, the pandemic will delay the return to normalcy of life so desired by all of us. Now, therefore, be it resolved that Rutland City Board of Aldermen endorse our healthcare providers' requests for assistance by strongly encouraging our citizens and visitors to wear a mask, take advantage of the vaccine and associated boosters, be careful in large groups, and follow appropriate hygiene. And in support of this, the Rutland City Board of Aldermen will purchase 50,000 masks for distribution to businesses that wish to have them available to customers and while the supply lasts. Masks will be available at Rutland City Hall and at the Chamber and Economic Development Office at 50 Merchants Row. Alderman DePoy?
So I'd like to move for the adoption of the aforementioned resolution.
Second.
All right, so we have a motion that has been seconded to adopt this resolution. Alderman DePoy?
Now, it's up to you, Mr. President, but I do have a question for Mr. Forte, if that's possible at this point.
Absolutely.
Thank you. So you mentioned masking, but the one that really gets to me here is the vaccinations. And over the weekend, I've been to 4 different pharmacies locally and one outside of the state. All of those are telling me that there are no vaccinations available other than an appointment. And I said, well, how long's the appointment before somebody could get vaccinated or boosted? And they said, well, it's about 2 weeks. And I started thinking to myself, 2 weeks in the state of Vermont, we have about an 85% vaccination rate, fully vaccination rate. How is it that the last 15% have to wait 2 weeks to get a shot at one of our local pharmacies? That's question number one. Yeah. And number two is for everyone here and those watching at home, if you can give some examples of where people can go for an on-demand vaccination shot, maybe some clinics that are going on, maybe a schedule of some clinics that are going on. So if somebody, say, Wednesday or Thursday wanted to go and get a vaccination, they can. But the first question about the pharmacies, why are they booking out 2 weeks if we have such an outbreak going on?
I don't know. You know, if I'd known this was coming, I would have gotten some more information for you. So I'm sorry, I don't know, and I can't speak for the local pharmacies. I do know at the hospital we are running vaccination clinics. You got to go on through the Department of Health website. If you go to vdh.gov and you go to the vaccine part, you can sign up and get an appointment. I don't know how long those are taking. We are trying to do whatever we can to make sure that at the hospital we have these vaccines. We're not in a walk-in situation at this point with the hospital. And one of the challenges we have is right now, and I don't know where everyone's gone, but I think all our staff have gone, but we are trying like heck to make sure not only are we staffing our beds, but we're also having some resources to administer the vaccines. So I don't know why, and maybe part of it is, hopefully it's because there is an uptick in demand and everybody's coming out to get vaccinated. I don't know why that is, but.
So what I got from the general manager of the store that I visited over in New Hampshire was that they are only allotted a certain amount per day, and they come in frozen or super cooled or something. And if they were to thaw all of them out, say they had got 20 doses that day, and 15 people showed up, they would waste 5 doses. Yeah. And I think it's probably quite a bit more than that would be wasted, or they think might be wasted.
Yeah.
It just seems to me that in this, you know, with what's going on in the state should, if there are a few that are wasted, but there's plenty for walk-in customers, so to speak, then that it should be available. And that's not obviously directed at you. It's directed at everyone out there who does administer that, oh, well, if a few get wasted, fine, but at least you have enough on hand for those that come in for some shampoo and some toothpaste, and they say, oh, well, you know what, I haven't been vaxxed, or I need my booster, I'm gonna go in and do that. And they can't, they have to wait up to 2 weeks, and that just seems ridiculous to me in, you know, with what's going on in our area.
Yeah, that's the challenge, right? None of this stuff has been simple, and the logistics for this, you know, that vaccine does have to be kept frozen, and once you reconstitute it, you got a limited shelf life, and each one of those vials has 6 doses. So you don't want to give 1 dose, or you don't want it sitting out there and waste 4, 5, 6 doses. I mean, we are fortunate in this country. We have plentiful access. There's a lot of people who don't have the access that we do. So even though it might be a little bit of a delay, you know, so I would say go to the Vermont Department of Health website and sign up now to try to do that. But there is, you know, the storage things and the administration and the window that you have, those all make it, it's not a simple thing. It's been a pretty complex thing. And I know at the vaccine clinic, when we were doing the mass vaccination clinic over at the Holiday Inn earlier in the spring, at the end of the day, we tried to time it right, but we started calling people. We had standby lists so that we wouldn't waste doses at that point, but it's even more plentiful now. So.
Now, do you know of any clinics that are going on in the area that people can take advantage of in the next few days? Well,
the Vermont Department of Health has come in and helped try to do some pop-up clinics. I know the primary care offices and community health are providing vaccinations through their offices, and the pharmacies are, and the hospital is, in conjunction with the, you know, you sign up through the Vermont Department of Health. But I don't know right off the hand, Alderman DePoy, if we have anything right walk-in at this point.
Thank you very much.
You're welcome.
So if I may, Claudio, and I want to keep you, first, we appreciate that you can come, and I think it's, I've appreciated your full-page ads that you've taken out in the Herald. I kind of missed the guidance that was coming out of Montpelier on a regular Tuesday that kind of brought everybody up to speed as to where we were and what they would like us to do. I guess my question is, and I don't know if you know this, is with Rutland County's increase, do we know if it's more kids, adults, vaccinated, unvaccinated, mixture of all? Do we know what's raising those numbers?
We don't know for sure what is driving those numbers. The only thing, when I talk to the Vermont Department of Health, they're thinking it might be the outcome of Halloween, which that's the only thing they can, and they saw last Halloween they have a spike. Even though we didn't have the parade, and you know, it was kind of a rainy night if I recall, and people, but they think that's probably what's driving it. Most of the people who are coming down with COVID are unvaccinated adults. We are seeing more kids get it. As a matter of fact, we're working with UVM and the other hospitals, both at Rutland Regional and in conjunction with them, if we have an influx of pediatric patients that have to be hospitalized. We have limited capability at Rutland Regional to take care of pediatric patients. We're working with our pediatricians and the other hospitals for how we can coordinate that care. But we are unfortunately starting to see more of an uptick of kids. We are seeing breakthrough cases, people who have been fully vaccinated. It's about 20% maybe of the cases off the top of my head. And that's why right now, even if you're fully vaccinated, getting boosted, wearing masks and practicing mitigation during this period of high transmission, it'll come down, but right during this critical period, try to protect yourself and everyone else by doing that. I appreciate your adoption of this.
Just real quick, I have you, Alderman Gillam. I know there's some people outside the rail who want to comment too. I'm going to go inside first, and then I will absolutely call on everyone else. So Alderman Gillam.
Mine's a clarification. Thank you very much for bringing this information to us. When you said the healthcare website, it's the same website when we were signing up months ago.
Yes.
It's the same system.
Yes.
Okay. Just want to make sure the people at home knew that.
We're putting some ads in the paper that have a QR code, so it'll bring you right to the website and it has the address. But it is.
Works pretty well. I used it. Works really well.
Good. Thank you, Alderman Gillam. Alderman Garuso.
Yes, I want to thank Mr. Forte and the mayor tonight. I like the unity and leadership is a good suggestion. I like the resolution. I've been in the hospital a lot, Rutland and Dartmouth and whatever myself in the last few months, and I think the unity, leadership, and maybe riding and driving people and haunting them to do this and be responsible. Over the weekend, I got several emails regarding this, and most of them were against mask mandates. One person called a lot of people in the community irresponsible, and I thought that was a real slap in the face. I've been vaccinated. I know a lot of people have been vaccinated. I've tried to be careful. But the only thing I was just going to get to, if a business owner or homeowner wants to, like you and like a lot of places, masks are required for entry, and I think that should be all there should be, and not us making laws and all that. So I support the resolution tonight, and I support anything that we can do to encourage people and show our unity and leadership on this. But I do recommend that if people have a problem in their business, we certainly support them in putting a sign in their window or at their home and requiring masks. And I don't think there's anything wrong with that, but I don't think we need a law for it. So I thank you very much, and that's my support of the resolution tonight.
Thank you, Alderman Caruso. Alderman Franco?
Yes, I mean, I want to thank you again, like everyone else, for being here. I wanted to ask, you mentioned encouraging, and that seems to be the take that you've reached with the mayor regarding a possible avenue that we could take, is just simply encouraging folks to wear masks and be cautious. How long has the hospital been encouraging by taking out ads or other education? Has that been throughout this pandemic? Is that changing dramatically that we should expect that would actually lead to a change as we see higher numbers and this spike continues?
Yeah, we've been trying to send that message throughout. Now, we actually, as you can see, during the beginning part of the pandemic when we were scared to death, we were out there providing ads and trying to provide as much information to the community as we could. And we were all prepared back then, and we were all unified. Almost 2 years later, right, the weariness of this pandemic has plagued us, right, and we've gotten fractured and so forth. We haven't been continuously doing that. Over the summer, we thought, like, after we got everyone vaccinated, we'd be in the clear. And unfortunately, we're better than we would have been if so many people weren't vaccinated. But, we had a downturn, but, this fall, it's crept right back up. So we're amping up our message in response to where we see the high transmission of the virus. We're not asking you to wear masks for the rest of your life. We're not asking people to, this isn't going to be a permanent thing. This will settle out at some point. But just right now, it's pretty prevalent here in Rutland, and we're nervous at the hospital. Right. What we don't want to see, and what I don't want to see, is our caregivers from the hospital and the front lines have to make some choices that you never thought you'd have to make in the public health care, in the United States healthcare system, that they have 2 or 3 or 4 critical patients, but you only have 1 or 2 beds, right? That's a choice that no one ever wants to make. We're doing everything we can to support our nurses and physicians and technicians so they don't have to make those choices, and we can take care of everybody fully that comes to us in need of care. So appreciate your unity on this, and appreciate you helping get the message out to our community at this critical time.
Alderman Dunges?
Claudio, thank you for coming in again. There's a couple of data points that you mentioned that I think it's worth reiterating. You said the majority of the patients that you have in Rutland Regional right now that have symptoms or are admitted there aren't vaccinated. You said that the breakthrough cases are 20% of the vaccinated, and the children who are getting this are also unvaccinated, or maybe only have the first dose from the reports that I read. Can we talk about how important this vaccination is again for another 30 seconds? Just because if the majority of the cases, so let's say you got, right now it says, according to the website, you've got about 14 beds for COVID inpatient, and then 4 that are ICU beds. So that's 18 patients in the hospital right now. If the majority of that, say 14 out of the 18, are not vaccinated, that's 14 beds that could go to someone else. That to me is a really significant statistic and speaks directly to what you're talking about. So can you spend another 10 seconds on vaccines and why it's so important.
Yeah, I mean, I'm not a clinician, I'm not a physician or a scientist, so I can't speak that well to it. But clearly, there is a difference, right? The people who are vaccinated have less, if they do get COVID, and they are getting COVID, but they are not coming into the hospital and they're having more mild symptoms. A lot of the people, those breakthrough cases, are people who have other comorbidities and chronic health conditions. So the message is, don't just wear the mask for yourself and do it for yourself. Do it for your grandparents and your elderly neighbors and those who can't protect themselves. Try to help protect them. And there is a group of people, like some of the people who are getting cancer treatment, that the vaccines, their immune system the vaccines don't work on them while they're getting chemotherapy and so forth, right? So they don't have that option that the rest of us do, and help us protect them as well by trying to slow that transmission.
Thank you.
One last one.
Sure, Alderman Franco.
Yes, I was wondering, does the hospital under your leadership require masks indoors? And if so, why?
Do we? Yeah, absolutely. And that has been the thing we've consistently had. And for those of us who are working in the emergency room, those frontline caregivers, they're not these comfortable masks. They're the tight-fitting N95 respirator masks. And you will know those nurses and doctors and technicians when you see them on the street, because they will typically have lines in their faces, or they will have Band-Aids over their noses where the mask has caused an ulcer and dug into
So to
their...
clarify, you are not encouraging people who enter the hospital, you are requiring that?
We're requiring, yeah, no, you have to, because, people are compromised in there, and it is just a standard when you're out and about in the hospital. We're all wearing masks
Public space,
unless we are in an office, and those frontline caregivers, they're wearing N95s for 12-hour shifts, shift after shift, day after day, month after month. So we're hoping that if we can get through these holiday periods and the end of the year, that we'll get to a point when we can get back to some degree of normalcy.
Even the patients, too.
Exactly. I mean, we've had to put some restrictions on the patients, and we've had to restrict visitation and some of those other things. That's not where we want to be. Those are burdens on everybody, right? So we want to get back to some degree of normalcy, and we will.
Thank you. Alderman DePoy, you had an amendment you'd like to offer?
So, Mr. President, I think this is something that everybody can get behind, and it's something that I just drafted based on the conversation we're having about vaccines. So if you can read that for me, and I'd ask for the board to support it.
Sure. And so following the resolution that's been presented, it would be, and be it further resolved that the Board of Aldermen strongly requests that the area providers make access to the vaccines more available.
Second.
There's a second. Discussion or debate on this amendment to the resolution? Alderman Franco.
Sure, I mean, just for clarity, what would enforcement of that look like for making it more available?
I'm not proposing enforcement on that. We are
Yeah.
talking about a resolution, so it's just the opinion of this board anyway. So it's just to encourage area providers, namely the pharmacies that we just spoke about, to maybe make it more available than 2-week scheduling. Maybe have some more doses available. So if somebody's in getting their shampoo, which I don't buy, but,
Right.
toothpaste.
So it's about sending a message.
I do
that
buy
we-
toothpaste, so, Alderman Franco. So, if you go into a pharmacy and all of a sudden you think, oh, geez, I should get my vaccine or I should get my booster while I'm here, just make it more convenient for people, especially in the setting where they do have vaccines and they do have the ability to administer.
Right.
So that's all that's asking.
Definitely. So just to be clear, sending the message that this is what is important.
Yep.
Isn't, okay.
Thank you.
Alderman Crusoe.
And I just want to add that all that's real. Why do I talk on this? I'm still, it's been 30 years now, I think, at the Regional Ambulance, and we've been administering those, going out to the public. And all of what Mr. Forte said is true. There's a low shelf life. I know they're expecting a shipment of vaccine and boosters this week, and they don't even know how many they're going to get. And then again, once they activate them, So it's a juggle for these guys too. I will, on their side, and with all due respect to them, but I support your amendment and I seconded it, and I think it's a good idea, but I think they gotta do the best they can and understand that to open one bottle that has 6 vaccinations in it and spoil 5 is not what they wanna do. So, and like Mr. Forte said, they'll get to the point where they're calling people, but it's a good resolution and I support it, and thank you.
Thank you. So we have a motion that's been seconded to amend the original resolution, and that's what we are about to vote on. Would all those in favor of adding this amendment, please say aye.
Aye.
Those opposed? Motion carries. All right, so this amendment has been added to the full resolution, and we're back to that. Are there any more questions inside the rail currently for Mr. Forte? If not, you've been incredibly patient. Please, just your name and your residence for the record.
My name is Seamus Martin. I live in Shrewsbury, and I'm curious if you will be publishing the exact number of breakthrough cases and also promotabilities.
We won't be publishing that, but I would go to the Vermont Department of Health. I think you can probably get some of that information. That's up to the Public Health Authority, and so they could probably get you that information.
Thank you. Lyle?
Justin, Rutland City, wanted to address Tom's concern of the vaccine, and I'm sure it's real, but I want to compliment the hospital and their relationship with the health department. 2 Saturdays ago, I went online and I made an appointment at 10:15 on a Saturday morning, and by 11:15 I've been to the hospital and I had my booster. So you can go online, it is quick. It's probably not convenient for everyone, and there should be more locations perhaps, but I want to compliment the hospital and thank Claudio for being here tonight.
Thank you, Lyle. Any other members of the public wishing to comment, to speak, to ask a question to this? Yep. Just your name and, address for the record.
I'm Sharon Stearns from Brandon, and I am a multi-small business owner and have customers in Rutland City, and I come to Rutland City and Rutland Town. And as I sit here, and I was involved in municipal government for probably 12 years, school district finance. And as I thought about this legislation, I thought, town select boards, you don't have enough to do already. You don't have enough to do, and your police force isn't busy enough. Everyone has been inundated with the television and the radio telling us everything we need to know, to be frightened every second of every moment that we're awake. We truly don't need the Rutland City Alderman to tell us again. We know Vermont Daily Chronicle for 3 months in a row has told us that the deaths from COVID have been higher in the vaxxed than the unvaxxed. We know that masks cause harm, and we know that people are taking care of themselves. People are so gosh darn frightened, they don't even dare leave their homes. Ask a UPS driver, okay? So you don't have to worry that people won't be masking most of the time. There will be some who won't. And you may think to yourself, what a selfish individual, what a terrible person. How could they? I could have used my power to straighten them out. But what you don't know, when you're sitting at this table and in your seats, is what they're going through wearing that mask. I have suffered since the day it was told. My skin is on fire. If anyone wants to come close, you'll see. I cannot wear them. So if you do not want me to be in Rutland City, then you make that decision. If you're afraid of me, if you don't want to be near me. But I'm asking you to please understand that everyone has the message. It isn't a possibility that you could live in Vermont and not get the message, and not know where to get your vax, and not know to wear masks, and not know all of it. It just isn't even possible. You would have to be a hermit on a hill with nothing. It isn't possible. So I ask you, do you really feel like we need more than the hospital, and more than the health department, and more than the governor? Do we really need you to tell us too? Because I already know. I already know. And so I'm asking you to please consider the people who've had domestic abuse and have had claustrophobia, the people who have oxygen level issues, and the people who have skin issues. We cannot comply. So I guess we'll die, or we'll drive somewhere else where we can, because we're not going to do it. I can't do it. I can't breathe. I have oxygen level issues. And so I ask of you, do you really want to be doctors in addition to being responsible for Rutland City? And are you prepared to train all of the businesses to comply with the Americans with Disabilities Act? Are you prepared to give them legal consults? Are you prepared to tell the taxpayers you're going to spend their money when it's already out there? I just ask you, do you have extra police resources? And if they quit and you had to apply, the police had to help, do you have new people lined up to hire? Because some of them just won't do this. So I'm asking you to think twice. I understand that what's good for you and your mother and your grandmother seems good for everyone else. But every business can put up a sign already, and they can say what they're comfortable with. But if you take limited staff that they already have, that's under stress, kids who are having issues in school, they're working, they're trying to juggle it all, and you make them enforce something that they don't want to do, they'll quit. And then we'll have businesses closing. So really what this would do is put more on the backs of small business owners. So let them decide. Let's trust them. Let's let them decide. Because if we cut their revenue, because I'm going somewhere else, I'm not coming to Rutland City, and I won't go to Rutland Town. So there is already a social media and email boycott of Rutland Town. It's going statewide. Is that what you want for Rutland City? Just be careful.
We didn't
Thank
pass
you.
the mandate.
Thank you.
I think.
And I just want to make sure. I apologize that I came in late. I'm so sorry.
That's okay.
So,
I just want to
Just
have
want you to
the opportunity say it.
just want you to understand where we
Thank you
were.
for listening to me anyway.
No, thank you. Just for clarification for those in attendance and those who may be watching at home, we are looking to pass a resolution showing our endorsement of the healthcare system's recommendations. If you are unable to comply for any reason, if there's something prevents you, or you just really hate masks, we are not mandating. There will be no police showing up and giving you a ticket, even if this were to pass. This is just our recommendation to do what we need to try to keep the community safe based on our local health system's recommendations. That said, other members of the public who do wish to speak to the resolution that's in front of us.
This is not COVID related.
Oh, then we'll do this and we'll get to you right after. Perfect. Thank you. Alderman Franco.
Yes. I have to say, I'm truly disappointed that we are framing this as a message of unity that is going to be effective, that is going to, make any difference if we are simply encouraging, because quite frankly, it does not go far enough. And while I appreciate our local healthcare leaders, not doctors as he framed, but leaders coming who have important information to share with us, I believe that the Centers for Disease Control and Prevention has made it perfectly clear that they recommend face coverings be worn by all people in public settings indoors and in areas with substantial or high rates of community transmission of the COVID-19 virus. And quite frankly, Rutland County is clearly in that state. The state of Vermont is clearly already seen as a community of transmission of high rates all across the state. It would be completely irresponsible for us to not actually consider the only tool that has been granted to us by our state, our governor, and our legislature, which the governor failed to do his responsibility and instate an indoor mask mandate across the state like he did 1 year ago, lest we forget that actually happened and we didn't see all of these negative things that people are saying. Maybe there were some cases of people who might not want to wear it because they have a medical reason. But I think there's ways to get around that. That is the beauty of policy, is that in enacting an indoor mask mandate, it's not black and white. It's not you wear it, that's it, end of discussion. There are exceptions. So I would, I simply think that this is not a moment where we look to the problem, throw up our hands and say there's nothing we can do, but please try to wear a mask, because that's clearly not working. And I think that by passing an indoor mask mandate, we would then reach the people for whom they feel comfortable not wearing a mask, but would wear one if it was the rule. Because I've talked to a lot of people for whom that is the case. And I refuse to believe that it is the vast majority of our community that would simply not do it and we wouldn't see any outcomes, see any changes. We are facing a spike in cases. We are facing a moment over the next month where we are going to be indoors in congregate settings, where we are going to have more opportunity for transmission. We have the emergence of the Omicron variant in the United States. It is ridiculous that we are sitting here and saying, let's not use the only tool we have simply for the sake of sending this unity message. I'm all for unity, but I'm also for action. I'm also for taking care of issues and being responsible with what we were elected to do. And I'm not claiming to be a doctor, but I am trusting our leading experts in the country who recommend to do this. And that is why I would like to make an amendment to add an enactment of an indoor mask mandate. I'm passing this along now. This was already reviewed by our city attorney. And if I may read it, just so that the board members have clarity and our public understands what I am proposing. Whereas the Centers for Disease Control and Prevention.
President, I'm sorry, can you just wait till we get it so we can read along with it?
Sorry, I can
Thank
wait.
you.
Can we do this while we have a motion on the floor for another amendment, or?
So if Alderman Franco's adding this is an amendment to it.
It is an amendment.
Okay, it's an
then
amendment, okay.
Yes, absolutely. And let's,
Yes, I will wait. Sorry about
that's
that.
okay. Everyone, oh yes,
We all set?
good. Alderman Franco, go ahead.
Whereas the Centers for Disease Control and Prevention recommends that face coverings be worn by all people, vaccinated and unvaccinated, in public settings indoors in areas of substantial or high rates of community transmission of the COVID-19 virus. And whereas Rutland County is experiencing a high rate of community transmission, and whereas all of Vermont is experiencing a high rate of community transmission, and whereas the local healthcare system is facing capacity strains exacerbated by the rise in local COVID cases, and whereas the Rutland City Board of Aldermen recognizes that COVID-19 remains a public health hazard in Rutland County and believes that wearing a face covering indoors is an important act that we all can do to reduce the further spread of COVID-19, and whereas in a special legislative session called explicitly and solely for the purpose the Vermont Legislature on November 22nd, 2021, passed a bill, the face covering bill, that empowers Vermont municipalities to enact local rules requiring the wearing of face coverings in indoor public settings, and the governor has signed that bill into law. Now, therefore, be it resolved that the Board of Aldermen hereby issues the following order effective immediately. 1, requirement to wear face coverings. All establishments located in the city of Rutland shall require both staff and customers or visitors to wear masks or cloth facial coverings over their nose and mouth while indoors at locations that are open to the public, especially in congregate settings, and where it is not possible to maintain a physical distance of at least 6 feet. There are exceptions for this rule, including young children under the age of 2, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, a person with a medical condition that is complicated or irritated by a face covering, any person while eating or drinking, and any person entering an establishment which actively screens and limits entry to patrons vaccinated against COVID-19, and any person who is alone in a public building. Pursuant to the face covering bill, this rule shall not apply to school buildings or school property, which shall remain under the authority of the school board. Each establishment shall post signage at the entrance and at other appropriate locations stating that customers or visitors are required to wear face coverings by order of the city of Rutland. A standard sign, which I realize is not attached to this, but will be provided upon passage, will be provided to businesses. This rule shall take effect immediately and shall remain in effect until the Board of Aldermen amends, rescinds, or suspends this rule by future action in a properly warned meeting, or when an action taken by the state of Vermont either nullifies this rule or the Board of Aldermen's authority to continue this rule, whichever occurs first. Notwithstanding the foregoing, the rule shall remain in effect for not more than 45 days following its initial adoption. The Board of Aldermen shall meet during the first 45 days in which this initial rule is in effect and vote either to rescind this rule or to extend this rule for an additional 30 days. Thereafter, the Board of Aldermen shall meet at a minimum once every 30 days to reconsider this rule, at which meeting the Board of Aldermen shall vote either to rescind this rule or to extend the rule for an additional 30-day period. To the extent this rule is still in place at 11:59 p.m. on April 30th, 2022, it shall be automatically repealed per the face covering bill. And this would be adopted tonight if we were to add it to the proposed resolution.
And just a question, point of clarification, Alderman Franco.
Yes.
Are you offering this as an amendment to the existing proposal, or is this a strike-all amendment? In that you would say, strike this to
I
put
do not
this
want
in-
to strike because I think the 50,000 face coverings that are being provided is important.
Yep.
This is to, as Alderman DePoy just added, to add this language as well, which would then enact a rule in amending it.
Okay, thank you for the clarification. All right, so we have a motion to amend. Do we have a second?
Oh, so I can't make the motion to amend, correct? Or did I made the motion, did we get a second? Is that what you're?
Yeah, looking for a second. We do not have a second, which returns us to the original resolution as amended and passed.
I call the question.
All right, the question has been called, so we have a resolution. It has been seconded, and that resolution has been amended and seconded and adopted. So would all those in favor of the resolution before us as amended, but with Alderman DePoy's amendment, please indicate their
Point of
support by
order,
saying.
we have to vote on calling the question.
Oh, I'm sorry.
Which ends debate.
All those in favor of calling the question, please say aye.
Aye.
Those opposed? Everything I just said previously now. With those in favor of passing the resolution as amended with Alderman DePoy's amendment, please indicate by saying aye.
Aye.
Those opposed? Motion carries. All right, thank you very much, everyone. Thank you very much, Claudio, for being here to speak to us tonight. It's sincerely appreciated.
Update it. It'll be good for the public to be aware.
Hopefully next time I have good news for you. Thank you for your support. All right, so we're still outside the rail, and I know you would like to address us.
As of many residents in Rutland probably don't know the quiet hours in Rutland. I'm assured that 9 o'clock is the nighttime one, but I spoke to 3 different police officers. They gave me 3 different answers. I have an issue where I'm being woken up every morning at 4:30. You were going to bring this up to change it or amend it or anything else. That would be a good time. I also feel that if you find the landlord a little bit, first warning, then the fines start coming in, the person will quiet down. I'm asking that you also find the landlord, because if not, they just brush it off. That's a good point. I don't know if it's the legality of it. That's something you have to look into, if you can do that.
So let me ask a question for clarification. What's happening is you're being woken up at 4:30 a.m. every morning?
Every day,
By a loud neighbor?
yes.
Okay.
But 3 different answers by 3 different officers. They don't have a real guideline to go by.
Okay, I
So I'm
think,
asking the board, give the police officers a real true guideline.
yep. Well, we do have the luxury of, we have Chief Kilcullen here. Chief, not to put you on the spot,
But you just did.
I needed a
Look
break,
nice
I'm
and
sorry.
tan.
If I could, real quick, 'cause
Please.
I've had a conversation
Okay.
with the gentleman about the noise issues he's having.
Yeah.
And my suggestion was to come before the board because of the different versions that he is hearing, and it's nobody's fault. I think it's the fault of the way the noise ordinance is written. It's loose, it can be interpreted different ways, and I was hoping that what the board would see fit to do would be to revisit that noise ordinance, send it to committee, and maybe tighten things up. So, issues like this or others which have come across my desk recently in regards to noise would be able to be addressed properly by the Rutland City Police.
And if I could ask a point of clarification, this might have been what I was looking for from you, Chief. It's clear at night when it kicks in, but not in the
9
morning.
PM at night,
But
I
it's the
believe.
question of the morning.
Morning, AM.
So under the city's ordinance, it is somewhat vague. We've, over the years, there've been a couple occasions where we used a state statute for noise in the night. And I actually spoke with the prosecutor at the time why a particular case, it was about 6 years ago, that was well advertised, why the particular case was not prosecuted. We cited the individual for violating that state statute, noise in the night, and had the conversation about why that wasn't ultimately prosecuted. So some difficulty with everything pretty much is on the books right now. So I think it is worth looking at to, I know a number of years ago we did start to have a conversation about that. I think in another similar case, not this gentleman's case, but another particular case that we had, and I had a conversation with the prosecutor about that. It was, what the statute we're looking at talked about the public inconvenience sort of thing, and this was more of a one neighbor, and there was really no public inconvenience or alarm or anything else. So there's some difficulty with the language right now, but I think it is worth looking at to sort of tighten up.
Thank you for that. So I guess I
I would appreciate if the board would consider it.
Alderman Talbot.
And thanks to the mayor, and thanks to the
ordinance
chief.
to charter and ordinance.
We have a motion that's been seconded to refer this issue to charter and ordinance. Any further discussion? Alderman DePoy?
I'd just like to ask if the city attorney has had a chance to look up the ordinance that we do have on the books, or no?
I don't remember it. I've looked at it before, but I don't remember it versus the state statute.
So
It's probably come up, I was gonna say, it's probably come up yearly since I've been in this position.
I think if I may, I think what we get hung up on is the decibel readings and what constitutes noise. That seems to be some of the things that we've had over the years is, is the lawnmower annoying? Well, at 3 p.m. in the afternoon, it's not, but at 3 o'clock in the morning, it is. So there was a combination of hours, time of night, decibel readings, and what constitutes noise. So I think those are kind of the hurdles that we have to get over in order to make it an effective ordinance.
Something like 9 at night to 8 in the morning would be good.
Sure.
Well, I think it'll be a little early.
9 to 9?
Because people go to work early at 7. People are up and going to work, so I don't know that you get it till 8 in the morning, but I think there was like 11 o'clock or 10 o'clock or 11 o'clock was the time that it started, and it used to be through kind of 6 a.m., so to speak.
Yeah, but not 4:30 like
Not
I'm
4:30.
experiencing.
Absolutely not.
My recollection, and the chief may know better than I, is that the only thing that the city has for ordinances has to do with car stereos, but
The
not.
boom box.
The boom box.
Yep.
But nothing to do with just general noise. And I think that's why they had used the state statute previously to try to rely on that.
So we have a motion to refer. It's been seconded. This will go to Charter and Ordinance Committee. If there's no further discussion, debate, or questions, would all those in favor of the referral, please say aye.
Aye.
Those opposed, motion carries. So we will, if you want to give your contact information to Alderman Gillam right here, we're going to send this to Charter and Ordinance, and soon, probably after the holidays, we'll call a meeting to discuss this. Thank you. So we're still outside the rail. Are there other members of the public who wish to address the board on items not on the agenda? Seeing none, this brings us to communications from the mayor.
The mayor's good now, we move on.
The mayor's good, we're moving on. Additions and deletions to the agenda. Are there any additions or deletions? Deletions, I see. Attorney Bloomer?
Actually, just hopefully a small addition to authorize leases for the tenants at 33 Summer Street, one of our new properties.
So moved.
Second.
All right, we have a motion. It's been seconded to add this to the agenda. Would all those in favor please say aye?
Aye.
Those opposed? All right. We are on to reports and letters from department heads and officials. Up first, Brennan Duffy, RRA, BIAP recommendation. This is page 1 of your packet.
Good evening, everyone. So I had placed in the board packet a memo from the RRA. We have another BIAP applicant who has come forth and has been reviewed by the Redevelopment Authority at our last board meeting. This is actually a new restaurant, which will be a cafe and coffee shop that will be going in at 87 State Street. The name of the business is still to be determined. The applicant is Chris Sabatasso and Cheyenne Webster. I did get a notice from them on Friday that they had had a close COVID contact and were not comfortable coming into this forum, so they are not here tonight to speak to this. But they have invested a significant amount of money already in the purchase of the property. They're fitting it up right now for their new venue. And the RA board has reviewed, found them meeting all the eligibility requirements, and is recommending a $5,000 BIAP grant for this new business.
I'll move to suspend the rules.
Second.
We have a motion to suspend the rules. It's been seconded. Would all those in favor please say aye.
Aye.
Those opposed, motion carries.
And I'll move for the approval of the 5,000 grant from the BIAP program to offset new equipment costs for the new investment of 87 State Street.
Second.
We have a motion. It's been seconded. Is there any discussion, debate, or questions on this? Alderman Gillam?
Just need the location, 87 State Street, where is that?
That is, was most recently Vermont Fresh Food Market. It's, I think, 2 doors down from the
Private
Stewart's.
Eyes?
The old private eye.
Before your time.
Yeah, before my time here, but, yeah, top of State Street there.
Thank you.
The black whale.
Black, that's before my time.
Alderman
Oh,
Leary?
yeah.
Yeah, this is great. Yeah, I'd love to see how many applications we've got recently, and we had a great news segment on WCX about all the new business coming into town. And I'm wondering if there is a way in which we can sort of onload these new businesses and make it clear exactly what resources are available, what permits they might need, because a lot of these have to do with retrofitting buildings or investing in sort of these renovations to support a new business. I think it would be really nice to have it very clear, you know, what building, what zoning permits you might need, and, you know, what sort of resources the RA could provide. So I'd like to make a suggestion that that's something the RA sort of looks at with other city departments to sort of support these new businesses as they navigate the municipal sort of regulations. And, you know, we could talk out of the meeting about that, but it's, I think it would be a great way to support these new businesses popping up, make sure they last for the long haul.
Thank you, Alderman Leary. Anything else? Any other questions, comments? Hearing none, there's been a motion, it's been seconded. Would all those in favor please say aye.
Aye.
Those opposed, motion carries. Thank you, Brennan. And Brennan, are you filling in for Barbara tonight?
I believe, are you here for Barbara? Oh, Susan's. Okay. So Barbara had her name on the agenda, but I think it's actually Ms. Schreibman who is going to be speaking on the resolution that was in the board packet.
Very good. So Suzanne Schreibman, TD Bank Green Space Resolution, pages 2 and 3 of your packet. And Dave Kuppick.
So, as I talked to you last time I came, there's this grant opportunity requiring no match from the city, and it's to plant 16 trees along segment 3 of Rutland Creek Path, install benches, bicycle racks, and some signs. And the total amount of the grant is $16,647. I think I said $500, but we added $100 for refreshments at the ribbon cutting ceremony. Part of this grant requires a community celebration, and we thought we'd coordinate it with the ribbon cutting of segment 3, being optimistic that in November we'll have segment 3 completed, and the trees and benches and bicycle racks and signs all installed. I think something of interest that I've never seen before in an application was the request to include indigenous, LGBT communities, different diverse communities, and how we would accomplish that. So we've included a couple signs that would be designed by Abenaki with some language about the historical use of the creek and the land surrounding it, thanks to Dave and Candy Jones, who have been working with that piece of it. So we've included that in the grant as well.
Thank you, Susan.
So I'll move to suspend it.
Move to suspend the rules, has been seconded. Would all those in favor of suspend the rules, please say aye.
Aye.
Those opposed, motion carries.
Motion to circulate for signature?
Second.
All right, we have a motion to circulate for signature. It's been seconded. Any questions, comments, feedback? Hearing and seeing none, will all those in favor, please say aye.
Aye.
Those opposed, motion carries. Thank you very much.
Thank you very much.
All right.
This is exciting.
This brings us next to Chief Lovett. Dennis Leary grant application, or announcement. We're very excited to hear.
Right. I'm going to keep you in suspense for just a minute. I realized that today I had not asked your permission to seek a American Fire Act grant for the proposed purchase of SCBA's, which are our air packs. Realized after talking to the grant administrator today that we might have a good chance at applying for it. So I know it is short notice, but I was wondering if the board would allow me to proceed with pursuing the AFG grant, which is something actually you don't have in your packet. The AFG grant we've used before for the purchase of extrication tools. We haven't been successful for 2 years because of a glitch in the paperwork from the previous administration, but I think talking to the grant administrator, it looks promising that we might get a chance to purchase these SCBA. The value of them, about $275,000. 2 years ago, we started the process by buying the air bottles, which takes about $1,000 a unit off. So it's going to be one of those things we're going to need very quickly, and so I'd like to proceed with the AFG grant if it's to your liking.
I'll move to suspend the rules.
Second.
All right, we have a motion to suspend the rules. It's been seconded. Would all those in favor, please say aye.
Aye.
Those opposed, motion carries.
And we'll move to authorize the fire chief to obtain the process for, I've forgotten the grant,
AFG grant. Yep.
AFG grant.
Second.
All right, we have a motion. It's been seconded to authorize the fire chief to go after AFG grant.
Yes.
Correct. Is there any discussion, debate, questions on this? Hearing and seeing none, would all those in favor please say aye.
Aye.
Those opposed, motion carries.
Next item on the agenda is a request to go out for proposals, an RFP for the removal of the contaminated soil next to the fire station. In the process of rebuilding the ramp in front of the station, we determined that the ground had been contaminated with what turned out to be a mixture of gasoline and diesel, or perhaps fuel oil. Seems to be lending back to the old Meldon School building, because we never had anything like that in the front ramp, but it was discovered, and I just got the test results back about a week ago, signifying that we would have to have a cleanup contractor bid on it. So I'd like to be able to put an RFP out to get the process moving.
Entertain a motion to suspend the rules.
So moved.
Second.
We have a motion to suspend. It's been seconded. Will all those in favor please say aye.
Aye.
Those opposed.
And I'll move to authorize the fire chief to do a request for proposal for removal of contaminated soil at the fire department.
Second.
We have a motion. It has been seconded. Is there any discussion, debate, questions?
I can just say I can remember Meldon School vaguely, but I do remember the chief, Kultonski, having a gas pump out there and used to fill his car with it, so.
Yeah, we used to have a gas pump out there, but kind of surprising, they actually determined it to be more of a fuel oil base.
Yeah.
They actually found a pipe buried in the front ramp when they dug it up, so. An old one, but.
Yeah. Awesome. Thank you. I support the motion.
Very good. Any other questions, discussion, debate? Hearing and seeing none, would all those in favor please say aye.
Aye.
Those opposed? Motion carries. Chief, you kept us in suspense.
There you go, okay. A couple meetings ago, I asked for your permission to allow Kyle Roblard, one of our firefighters, to proceed with the Dennis Leary Foundation grant. This grant is given out to fire departments for primarily safety and training. Dennis Leary had close ties to the Worcester Fire Department. He lost relatives in the event. So he set up this foundation. They make awards specifically for firefighter safety. Kyle Robillard proceeded with it and got notification that he has been, his grant application was awarded. So we have the possibility, if you so deem, to allow the mayor to sign the contract, that we can proceed with receiving this grant. It's about $7,500.
Motion to suspend the rules?
Second.
Motion to suspend the rules has been seconded. Would all those in favor please say aye?
Aye.
Those opposed, motion carries.
Make the motion to allow, or to authorize the mayor to sign the form to receive the funds for the grant.
Second.
Mr. President?
Yeah.
This resolution is for the board to sign,
Is that another one?
if this is what we're looking at.
Circulate.
So I'll,
Circulate for signature.
yeah, circulate for signature.
There you go.
I'll,
All right, so we have a motion to approve and to circulate for signature.
Seconder agrees.
Second agrees, perfect, thank you. Any discussion, questions, debate? Hearing and seeing none, all those in favor, please say aye.
Aye.
Those opposed, motion carries. Chief Lovett, thank you very much.
Thank you
It's
very
exciting
much.
news.
Rock and rolling over there.
All right, Attorney Bloomer, we're going to move you to the end. That brings us to reports of standing committees. Alderman Gillam, Charter and Ordinance Committee.
Do you want to allow the chamber people go ahead of us, since it's a late hour here?
Yeah, actually, I'd be fine
I
with
will
that.
yield to the chamber, or Cedar, Cedar.
All right, Alderman Gillam would like
Chamber Cedar
to
Reddick?
yield to the chamber, or Reddick, Cedar, everything.
Yielding to you, sir.
Yeah, we don't know what we call ourselves either.
But you,
Every once in a while, just to
Keep us on toes.
keep it down on the
welcome,
down
and
low.
this is page 13 of your packet, everyone. Lyle, the floor is yours.
Thank you very much, and you know why I'm here. Whenever you see me, I'm coming to ask for money, so I'm not going to disappoint you. I'm going to ask for money. Not only am I going to do that once, I'm going to do that twice. So first, though, we're here to talk about, Kim Roop is here from our organization. She is the Communications and Community Engagement Director. And Kim has been putting together statistics about the Regional Marketing Initiative, because when I ask you for money, your question should be, what are we getting for our money? And so Kim has some statistics that she would like to share with you, and then we'll tell you how much money we're requesting. But first, we'll have Kim tell you about the statistics. So, Kim.
I first want to thank you guys for your continued support for Real Rutland and our regional marketing initiative. It has truly been an amazing effort, and we're excited to share some statistics with you. So if I may, I have some one-page handout for you. Can I just pass this? Oops, thanks, Lyle. So as I'm sure you can imagine, statistics like this don't happen overnight, so we're excited to be able to share this with you. It takes time for people to move. It takes time for them to move across the country. So as we enter into year 6 of what is currently a 10-year plan, we're seeing, as you'll see in your packet in a moment, in the past 5 years, we've seen over 100 individuals have moved into Rutland County as a sole result of Real Rutland and our Real Rutland Concierge program. That equals out to just over 50 families. So some of these people are single adults. Some of them are families of anywhere from 2 and beyond. So we've seen a nice diverse group of people moving into the area and size of family. Most of these people that are moving into the region are moving into the city of Rutland. We have seen almost all of them are moving into the city of Rutland. We are hoping to see more move into a more countywide representation, but I am happy to share with this group that most are moving into the city of Rutland. A prime example is one of your new downtown businesses on Center Street. Primary result of this Real Rutland initiative. They are proud supporters of the city of Rutland. They recently opened a small business. They're opening an apartment above that small business and continuing to support the city and beyond. We've seen over 10 towns represented through this beyond the city of Rutland, so that's also an exciting statistic to share. Obviously, if someone moves into my hometown of Poultney, that's still a win for the city of Rutland. They're supporting your businesses. They are supporting the city. Some of the industries that we've seen them move into, a lot of remote workers, I'm sure that's not a surprise, but we're also seeing a lot of healthcare workers. We're seeing nonprofit leaders and several other industries represented as well. Our Real Rutland Concierge program, we have a tremendous amount of representation of concierge volunteers who are Rutland City residents. We have over 25 very active volunteers right now, all of which are representing Rutland County in a very positive light, and they're helping people navigate the move, answer questions about what life in Rutland County looks like. On the back of this, you'll see some statistics to our current campaign. We are currently in quarter 4 for 2021. We are using platforms such as social media, paid search, LinkedIn, Killington TV, as well, and some display ads. We are using Killington TV to take advantage of those ski and snowboard enthusiasts that were here for World Cup. And you'll see on the right-hand side just what our estimated reach looks like for each of those platforms. So that's wrapping up a little bit towards the end of this year, so we have a few weeks left. And then at the very bottom, you'll see just kind of some general stats. We have over 3,000 Facebook followers, just over 1,900 Instagram, and over 4,500 people are seeing our email marketing on a regular basis. So very pleased with the results as we enter year 6. Happy to answer questions if you have any, but otherwise I'll turn it right back over to Lyle.
Any questions? All right, Lyle?
I don't have enough of these for everybody, but I will pass them around and they'll end in the end. We've been at this, we're now in year 6, and we have raised about $606,000 towards this project. We've spent just over, and this is as of the end of October, we've spent just over $544,000. The remainder will get us through March town meeting when we begin to see revenues coming in from our municipalities that have been supporting the project and area businesses that continue to support the project. You'll see that Rutland City has been very generous, and we appreciate that. This could not have happened without Rutland City's contribution, and hence why we're here again tonight. You began years ago with a $100,000 donation from the Zamias Fund. There was $50,000 in one year and $50,000 in the next. Since then, we've been asking for $1 a person, and that has ranged right around $16,000. You will see that primarily the business community is supporting this effort, followed closely by Rutland City and then the other municipalities, and then grant writing that Kim has been doing very aggressively. And you'll see where the money's been spent. If I were you, I would then ask, well, who are those companies that are giving you money, and what other towns are providing?
Sorry.
Who are those other towns that are contributing? So you're not the only town. And we being Kim and I, have been going out to the communities and talking to them about how this effort will help them. So we're here tonight to request continued funding of the Regional Marketing Initiative in the coming year in the amount of $16,000. More than willing to answer any questions you have, but the real sweet sauce in this whole thing is what Kim talked about just a second ago, and that's the concierge program. That doesn't happen anyplace else. We hold people's hands until they come here, and there are a bunch of people who are in the pipeline. Will they all come to Rutland City? No. But will they come to Rutland County? We sure hope so. And we might say, well, I just saw the population decline from the 2010 census to 2020. It did. But what would have happened if we hadn't been doing this effort? I would hate to think we'd be losing even more people. And frankly, all around the United States, everybody's doing the same thing. They're trying to get people to move to their community. They're being very aggressive, and we need to continue to be aggressive as well. Thank you for your past support, and I look to you to tell us what we can do to encourage that to continue, and I'll answer any questions you might have.
Thank you. Alderwoman Davis?
So, Lyle, some of the other towns are not based on population, they're just based on whatever, an ask for a dollar amount. Okay. So, and the other thing I think, we know that the Zemaya's fund is kind of dry. So I think, if I may, refer it to the mayor. And I think the mayor's probably going to speak to it, but I think if I can, I'll refer the request for $16,000 to the mayor's office.
So, just very quickly, I have had a couple of conversations with Lyle and have looked at the paperwork that he has brought out to you. And, you know, this is we were in it for the long haul. We knew that back when we first signed up at the 100 grand level. And I think we need to see this out through the 10 years. So I am supportive of the ask. There aren't many places to get that money, and one is the contingency. And the mayor's contingency does have enough in there in this year to cover that that ask. So I would be supportive of doing that.
So with that, Mr. Chairman, I'll move to approve the request from the, of $16,000 to continue regional marketing initiative, the money to come from the mayor's contingency fund.
Second.
All right, so I have a motion.
Suspend the rules?
Oh, indeed we do. Motion to suspend the rules.
Oh, I'm sorry. Thank you.
Thank you, sir. We have a motion to suspend the rules. It has been seconded. Will all those in favor, please say aye.
Aye.
Those opposed, motion carries.
And then my motion.
And then Alderwoman Davis has made a motion. It has been seconded. Is there any discussion, debate, or questions regarding this authorization of funds from the mayor's contingency fund? Alderman Talbot.
Yeah, I just want to voice my support for this. I'm glad that the mayor is willing to support this as well, and other board members. I mean, $16,000 just to attract residents like the Boudreaux is a great return on investment, right? The amount of money that they're putting into this community and the amount of revenue that they're going to generate for this community moving forward. So I think you guys are doing great work, and I'm excited to see it continue and excited to see us continue to support it. Thank you.
Thank you, Alderman Talbot. Alderman DePoy.
So Lyle, one of the things that strikes me about this and what's going on, I mean, we just had Claudio Forte here. He's got a lot of traveling nurses that are at his hospital. And I'm wondering, have you done any outreach to traveling anybody, traveling people of anything, whether it be traveling nurses, somebody that's here to sell pharmaceuticals maybe to different doctors' offices, anything like that, where people are entering. Are we getting a grasp and maybe grabbing those people and pulling them aside and saying, hey, we'd love you to live here, not just sell, or, you know, obviously we like them buying here, but sell here? I mean, what kind of outreach do we do for those kind of business professionals that are coming into the city? I mean, traffic in the city is a lot more than 15,000 people.
Exactly.
That's for sure. So how can we grab these people to say, hey, we have lots of job opportunities, we really would like you to be here? What are we doing in that respect?
Kim is way smarter at answering these questions than I am, and she can talk to you about our incentive program and how she targets particular audiences using something that I rarely use, which is Facebook.
Couple different things to answer your question. We have done prior campaigns that are specific to job seekers that are external Vermont. We've seen more success by highlighting the lifestyle here in Rutland County. So that's part of the answer. We have certainly increased our local ads more recently to highlight and target people specifically for that. Killington TV, for example. You know, while I use the example of our ski and snowboarders that are here for World Cup, the people that are here for our traveling nurses are also watching these same ads. We're working very closely with the Mountain Times to do local ads with them, and they have been very generous to support our work. So we are certainly increasing our local ads, but I love your suggestion as far as reaching out to the traveling nurses and things like that to certainly take advantage.
And one last thing, and I say this in a joking manner, but I'm dead serious. If you could get together the police department, they could use a few guys over there and help attract some you know, some boys in blue, because we need them. And there's a lot of areas in this country that are pushing their boys in blue out, which I think is horrible, but it may be good for a community like ours.
And we have had conversations with Sergeant Lorman about recruitment efforts for increasing the police workforce, and
And they
just
don't
chatting
have
with
to
him
live in
today.
the city either. I mean, they could, but they, you know, their employment would be. We would like them to, but, you know, priorities first.
Absolutely.
So thank you.
Thank you, Alderman Defoe. Alderman Dunges.
Absolutely. So I'm in huge support of this, the regional marketing initiative. I've seen direct success with my own eyes. I think it's fantastic for the city, not only for people coming in, but the positivity within the city, right? One of the first initiatives, if I remember correctly, of the Real Rutland campaign was to get people to recognize how positive a place Rutland is, and then that's transpired into what it is today. I think it's great that we're gonna provide this funding, I believe, that if this passes. My question is, do you see the regional marketing initiative ending anytime soon?
No.
Okay, so then my response to that would be, I think this is something that needs to be added as a budget line item in future years. And I think that's something that we should talk about over the next year. Obviously, we can't make it for this year, but it's definitely something that should be in reoccurring years because of how important it is. Rather than having to pull it out of the mayor's contingency fund, I think this is something that the voters would absolutely support and should be a regular thing.
Thank you, Alderman Dunges. Alderman Gillam.
This is the first time I've seen this report with all the towns in here. You got 12 towns here, which is almost half, just about half of Rutland County towns, which is pretty impressive. I also see in here a lot of the business people anting up. This is a great program. This makes me very happy where I can go out and sell this because I know it's a joint effort, not just us, but the other towns are involved too. So I think this is a great tool here to use to market it for the local people to understand what we're doing here.
Oh, thank you for that. And the business community, as you know, needs employees, and they see this as a mechanism to help get them employees. I want to thank Michael Talbot, who is on the marketing committee and is our liaison to you folks. I want to thank Michael Dunges, who long ago came up with the idea of lifestyle locations. And he said, this is a lifestyle location right here, where we're living. And we know we have the best police force around. We just want more of them.
Very good. Other questions, comments, discussion?
If I may,
Yes.
I think, Lyle, to Alderman Gillam's point, it's nice to see facts, because we've just seen video. And, you know, the ads for Real Rutland, which have been wonderful, but there was no proof in the pudding. It's nice to see the proof in the pudding, so appreciate it.
And we would encourage you to encourage people, even if they live in Chittenden County, to look at our website because we have incentives that they can get by moving here. And that, we don't care if they come from Whitehall, Burlington, Nevada. They'll have about $2,200 of local incentives that local businesses have provided, like the Mint Maker Space and others, Killington Resort. Kim shouldn't be saying this now because I can't remember the rest, but a whole bunch of others that are local businesses that are supporting the move of other people. So, thank you so much.
Thank you. Any other questions, comments, debate? If not, we have a motion. It's been seconded to fund $16,000 to the marketing initiative out of the mayor's contingency fund. Would all those in favor please say aye?
Aye.
Those opposed, motion carries.
Thank you to the mayor. Thank you.
Thank you very much, Lyle.
All right. I did say I had two asks.
Right.
The next one is, this one's for even more
Second
money,
one's a big
okay?
one.
Ooh, all right, let's hear it.
Tyler Richardson is here. He's our operations director. He's been working very closely with the Center on Rural Innovation to bring a downtown digital economy hub co-working space to your city in downtown Rutland. And Tyler can talk to you a little bit about that, and then we will ask that you tell us where we should go in a very nice way to talk about it some more.
Good evening, everyone. I am not asking for any money this evening, so you do not have to run. Just run from my personality on my face next time you see me. We have been working, this is really just the start of a conversation we'd like to really have with the board. We've been working with the Center on Rural Innovation for about a little less than a year now to develop a downtown incubator, accelerator, co-working space centered around digital economy jobs, the jobs of the future. We have been, so the Center on Rural Innovation, I can get into this more as, you know, in a formal presentation, however you guys would like to see that presentation. But the Center on Rural Innovation has a track record of working around the country with rural communities like ours in developing these types of assets for our communities. Right now, we are one of 20 communities working around the country with Quarry, and we are really we're barreling down the tracks with this project. We have partnered with a property owner in downtown Rutland to make this a reality. We are targeting the Opera House in downtown Rutland to house what we're calling the hub. We would really appreciate an invite to whether it's a committee or whatever you guys think is appropriate to learn more about this. But ultimately, what we're talking about is a multi-million-dollar development in downtown that's going to bring people, it's going to bring jobs, it's going to develop the types of businesses that require digital economy jobs, remote type of jobs, the jobs of the future. And ultimately, at the end of the day, yes, we may be coming back and asking you for grant matches, because we are in the process of writing multiple grants in partnership with Corey to bring multiple millions of dollars to this development. So with that, I guess I'll open it up for questions or comments.
Very good. Alderman Dunges, so you're in.
Sure, I have a question. Is there, based on the letter, it looks like there may be a request to pull from ARPA funds specifically.
Yep.
If that's the case, I'll make a referral, but my ask would be to take some time to look at the ARPA requirements and regulations and really form your ask based on those guidelines. As much as we love to give money to all sorts of things, we have to follow those rules, and it's going to be, yeah. And I know you guys are good at that because of grant applications all the time, so maybe just make sure you're really within those guidelines when you come.
I appreciate that guidance.
And with that, I'd like to refer to finance.
Second.
Right, we have a motion to refer to finance that has been seconded. Any discussion, questions about that referral?
If I may.
Alderman
So,
Davis.
we were kind of speaking prior to the meeting because we have internal requests for ARPA and some external requests for ARPA. And to Alderman Dunge's point, we don't have really any final guidance to say this is acceptable, this is not. What we do know that is if we fund something that's not, we have to pay it back.
Yeah.
So we don't want to get into that. So we also, through Alderman Leary, kind of developed a matrix that we can list these programs and make determination as we go forward that they do or do not meet the requirements of ARPA. So it's going to be a little longer process just because we need to be diligent as to what we can and cannot fund. So we're going to start meeting the first week of January.
Okay,
that's
perfect.
the point that I'm getting to. So we may hear you and put you into that matrix. You know, there may be a tentative okay, so to speak. I just want you to understand what that process is and why it is what it is. And then, you know, hopefully this will be an acceptable process, and it will also depend that you need to be thinking dollar amounts as well.
Yep.
Because the city has, as I said, internally for the city, have a number of requests, and we need to make sure that we can try to balance all these the best we can.
Appreciate the clarification, and I'm more than willing to come back and talk any amount of time it takes to.
What I'll do is
as
I'll
we
make
work it
sure,
out.
you know, I'm going to talk with the finance committee, you know, what do we want to hear first, because we're probably going to have to break it up into a couple of nights, because some of the presentations may be a little longer. And get, as I say, get them into these matrix. We know that certain projects, like some of the proposals for DPW, are given that they're going to be approved.
Yep.
But then there are other requests that we have within the city that are questionable. So these are the type of things that we have to figure out more. It's a cumbersome process, and I apologize for that, but I just wanted you to know up front, because when we say yay, we want to make sure that we're right and that project gets funded.
Appreciate that, and I appreciate the amount of time you're giving to the cumbersome process and making sure that this is done correctly and transformationally. So thank you all.
Thank you. Alderman Franco.
Yeah, I just wanted to say thank you for engaging in this critical work and thinking about the future of work and about, you know, setting Rutland up for success in that vein. Full disclosure, I'm employed by the Center on Rural Innovation, but I just wanted to point out that when we think about our communities across the country we work with, Rutland City always stands out as, you know, folks that routinely come up as really engaged and who have their heart in this work and who are really driving forward and putting everything they have into this, which doesn't happen in all communities, right? And so I think, you know, that's just a testament to the work you all have been doing. I'm very excited, but of course, if this comes to a vote, I would be abstaining in later conversations, but just wanted to clarify. That's cool.
Well, thank you for saying
Thank
that. It's nice to hear that. We feel sometimes we're a little impatient, and we're really kind of pushing on them, so it's good that we're all working together on this. So thank you for that.
So we have a motion to refer to finance that has been seconded. There's no further discussion, debate, or questions, but all those in favor, please say aye.
Aye.
Those opposed, motion carries. Thank you very much, Tyler.
Thank you. Thank you, everyone.
Everybody else say aye.
You just laughed.
Thanks, guys. Okay, so we're actually jumping back to reports of standing committees, and this brings us to Alderman Gillam, Charter and Ordinance Committee.
Thank you, Mr. President. Charter and Ordinance met November the 22nd, 2021 in the downstairs conference room. Present committee members were Leary, Davis, and Chair Gillam. Others present were Alderman Dunges, Talbot, Franco, Alderwoman Salvage, Mayor Allaire, City Police Commission Chair Sean Sargent, Police Department Commanders Sheldon LaChance and Delpha, RRA Director Duffy, and the City Attorney by telephone. Members of the public were Josh and Anna McDuff, and I believe I misspelt that name. I believe it's Kiana McClure. And we will make that correction in my report. Sorry about that. The agenda was cannabis retailers and integrated licensing, a ballot issue for March 2022. Call to order 5:30. Debate was about the use of cannabis products. Against the proposal was the Rutland Police Department members and the chair of the Rutland Police Commission. By the way, there's a letter in your packet from the police commissioner, from the police commission chair. He could not be here, so the letter is in for the records on his opinion. So you can read that at your pleasure. The issues with the department were enforcement roadside tests for cannabis. No formal test was available. It's against federal law. Sworn officers have taken an oath to uphold the state and federal law, which has a conflict, and the product abuses and product tampering. Pro for the proposal were Josh and Anna McDuff, who are proposed owners for the cannabis retail store, and from the public, Kiana. Control environment, growth locally with local retailers, in-depth state regulation process for local growers and retailers. If do nothing by municipalities, the state law will take effect 2023. And then we talked about state revenues. Others who were in the debate was the mayor and other aldermen on concerns pro and con. The city attorney briefed the committee on the state regulation process, the state statutes, which was passed in 2020, and the effective dates. Retail licensing applied from the state for October 22nd. That's for any store that wants to have a retail operation. They can't get it until 2022 of October. The city will have to put in place new ordinances pertaining to the retail sales and control process and tax issue. Alderman Davis moved the issue to the full board to allow the cannabis retailers in the city of Rutland to be decided by the voters of the city of Rutland to be on the ballot for the city election in March 2022, pending language from the city attorney. That vote was 302. Now what I'm going to put on the floor is actually another motion, which I had got a memo from the city attorney. And the motion is to petition the mayor to call a special election on the town meeting day in 2022, the following question. The cannabis retailer licensing pending the language. The city attorney has sent us some language, and you should have a memo on your desk. There's two of them in the back, and this is open for debate on which one we want to put on the ballot, which we're going to refer to the mayor to put on the ballot. I'm going to turn this over to the city attorney to discuss the two proposals.
If I may,
Yes.
point of order, Mr. Chairman, we need to vote on whether or not we even move it forward before we vote on the language.
I thought you might want to talk about the language first.
Well,
I'll do whatever you want. And I so
think
moved.
the motion coming out of the committee was to move it forward, so I
Right.
think we have to vote on that motion first.
But the city attorney told me we had to have a different motion.
Well, we could, we have to have a motion to whatever your motion is, but we still have to, before we decide language on the ballot, we need to decide whether we're going to put it on the ballot. And I think that's where we are at.
That would be fine, yeah, you could either amend what's coming out of committee with the actual language that you want to put on the ballot and then have the ballot question, or the ballot vote, or you can have some intermediary vote that says, yes, we'd like to have the city attorney tell us about what our options are, and then go from there.
So, to clarify?
Yep.
Just following the lead of the city attorney, we need to put on the floor the petition the mayor, if you want to do that or not. That's the next step.
At some point, that would be what puts the question of whether it gets onto the ballot or not onto the floor. But if you want to have a vote as to whether you want to even talk about it, then you could take that vote and then we could talk about it if you vote yes.
I'll do what the board wants to do.
So Attorney Bloomer, what's more sensible in this case, to take up the motion that came out of the committee, essentially authorizing us to move forward and place this on the ballot? Right. If we agree to place it on the ballot, then we would have a discussion.
Then it'll be step 2.
Yeah, I mean, I think if the vote is no, coming out of committee, then that saves everybody probably 20 minutes of listening to me talk.
Let's do it that way.
Okay.
Thank you.
So it sounds like.
That's the plan.
So, all right, so the motion is to essentially authorize, or is it for the?
Before that, whatever the committee
To petition the mayor to call a special meeting on town meeting day 2022 for the following question to be decided, but to authorize this question to go on the ballot. Okay. I
have a question.
Yes.
Me too, I don't laugh.
Seeing it's just, in the 14 years I'm working on being here, we have never had a so-called special meeting of the mayor on election day. I'm not quite sure what this is in regards to, so the bells are going off in my head saying, I'm not quite sure the process or the procedure is down. I don't know why the mayor would need to call a special meeting in that capacity. Any person can get a question placed on the ballot through the petition process, or you folks have the ability to do so. It's pretty cut and dry. It's very simplistic. All you have to do is decide you want to put something on the ballot, you come up with a language, it's on the ballot. It's as simple as that. In regards to how, because of the state regulations, the attorney may have specific language that needs to go on there, but if you want something on the ballot, and 6 you agree to it, it's on the ballot. Or if someone presents a petition to me with 5% of the registered voters' signatures on it, it goes on there, whether you like it or not, it goes on there. That's state statute.
Right.
So again, I just am concerned with what this so-called special meeting is, because I don't think there really needs to be anything at this point in time.
Mr. President, I think we should just take the original motion out of the committee and have the full board address that.
Okay. So we're taking the original motion that comes out of committee, which is to allow retail cannabis to be on the March 2022 ballot.
Second.
Okay. Alderman DePoy.
So the clerk brings up a lot of good points in that. There's still quite a few questions there. And my biggest question is the motion that came out of committee doesn't say whether this is a binding referendum or an advisory referendum. Doesn't say either. So, you can't just put something on the ballot without letting the people of the city know, but first of all, letting us know here as a board whether you're proposing a binding referendum, something that the voters, whatever they say goes, or a non-binding referendum, which is advisory to this board, and then this board has the final say. So I would move at this point that this be recommitted to Charter and Ordinance so that these questions can be worked out both for the clerk and also the wording from the city attorney, and also whether this is going to be a binding referendum or a non-binding referendum.
Okay, Attorney Bloomer, a motion to refer something back takes precedence, correct? Right. Yeah. Okay.
We talked about it, but we didn't decide.
So,
What's going on?
My motion is to recommit so that these
What I'm
issues can
confirming
be
is
cleaned
that
up.
the motion to just re-refer back.
There's debate on the motion. to
Debate on the
refer.
motion.
Yeah.
So my question is to the city attorney, do we have the answer to whether it's binding or non-binding?
It's binding.
Okay, so we have that answer.
Does it say that somewhere?
I don't,
And don't forget, he advises, his opinion is his opinion. We don't have to go with that. I mean, but I would like to know where it says in this that it's binding. It doesn't say that.
Doesn't say it.
the shall
Shall,
language.
the shall language.
What was your other question?
Shall instead of
Do
may.
you want to be here all night?
So
Right.
may would mean it comes to us. Shall means once they vote on it, that's the way it is. Is that
I
right?
don't know I don't think, while I've been here, I don't think we've had a non-binding question, so I don't know what the wording usually says in that instance. But in this instance, there's nothing here to suggest that it's not
I think they're here.
binding.
Doesn't say shall. So, Mr. President, this does not say shall anywhere in the motion. So I don't.
It does in the question.
It does in the question, because we didn't know what the question was when we were in committee. So that's why we referred to the city attorney. That's why you have this memo from him explaining.
So if I may, it sounds as though if we were to vote in favor of this, it would lead us to the next step, which I think to answer your question, Alderman DePoy, it would be placing a question that is binding on the ballot.
On the ballot.
If we vote to approve the motion as presented.
And it says that here in the, point of order, you're gonna have to clear that up for me. It's not in the motion that it's a binding referendum, and it needs to be in the motion that it's a binding
I'll
referendum.
amend the motion to say that it's a binding referendum.
Second.
Have the motion to refer.
So I guess first we still have
Deal with the motion.
to
refer.
deal with the motion to refer. So there's a motion to refer back to Charter and Ordinance that was seconded. Those in favor of re-referral of this issue to Charter and Ordinance Committee, please say aye.
Aye.
Those opposed?
No.
Okay,
Failed.
failed. Now, Alderwoman Davis has offered an amendment to indicate that this resolution is a binding, or that this is a binding question that will go on the ballot.
I'll second.
And that's second. So we're going to vote on the amendment. All those in favor of amending this motion out of committee to indicate that this is a binding issue on the ballot, please say aye.
Aye.
Those opposed? Motion carries. Okay, so now we have in front of us to place on the March 2022 ballot the question of, shall Rutland City allow retail cannabis sales?
And so, Mr. President.
Yes.
I'm not opposed to this going to the voters, but for the issue of clarity as to whether this needs to come back to us or whether the vote on March, whatever it is, 5th is final, that's what I want to make sure that we know, okay? Because if it's not a binding referendum, then it has to come back to us to go on another ballot.
Right.
Okay. So, we're good.
Yep. Thank you, Alderman DePoy. Mayor Lair, I did see you. I didn't know if you wanted to go for Representative Knott.
Thank you. I was in the legislature when we passed this to allow communities to add retail cannabis. And it spent quite a bit of time in my committee, Judiciary Committee. And this, under state law, this board, any municipal board, does not have the authority to establish retail cannabis. The only way it can be established in a community is by a vote of the general public. So, I mean, yeah, I suppose you could argue whether to have as you did, a binding vote or a non-binding vote. But at the end of the day, the only way that retail cannabis could be established in Rutland City or in any municipality in the state is by a vote in a general election. So, at the end of the day, this board or the mayor or whoever could vote to put the question on the ballot, but the people of Rutland or whatever municipality are the ones who decide, and that's state statute now.
So it's appropriate that we make this a binding referendum as it goes to the people.
Yes.
Thank you.
And that was our
Thank you.
intent, I believe.
Mayor
Which
Lair.
leads me to the question, excuse me, if we needed a supermajority of the board to place it on the ballot. Rather than just a simple 6.
Yes, you need 2/3.
We need
It's actually,
Seven.
but tonight, with Chair Wickham not voting and with Alderman Clifford not here, it's 2/3 of the members present and voting. So it'd actually be 6 tonight.
6?
6, okay. Thank you, I just want to make sure that was clear.
So I just have a question, and maybe just logistics, that we request the mayor to call a special election, even though this will happen in, when, are we doing November, or are we doing March? Do we have to decide that? And this board has the power to place a question on the ballot, so I guess I'm questioning why we have to petition the mayor to do so.
It's charter language, and again, we probably have, we do a lot of things technically incorrect, so
That's okay,
we've probably done it wrong previous to this. So it's charter language allows, and a special meeting is, it can be a standalone election, but obviously that's not very cost effective. So really the annual meeting, the general election, is just the election of, all of you, or when your seats are up. Every odd numbered year, it's the mayor, and then of course the budget. Those things are built in to the election. There, you don't have to vote by 2/3 majority to put the mayor's election up for, every other year.
Okay.
So the special meeting is really just anything that's outside of those items that are not automatically provided for in the charter.
Okay.
That's considered a special meeting. And doing it on the same day as the town
March
meeting
election.
makes
Okay.
sense from a financial standpoint.
That's fine. Nope, that's fine. It's all right, Henry. I'll email you later.
Technical questions. I don't want to be the smartest guy in the room, but I really don't. But I just have questions that I'm afraid you may not understand. And respectfully, this coming March, we have an election, again, in my 14 years. Normally, the night before the election, we have a meeting. This year, we will not. Well, kind of. But if we're holding a special meeting, you're going to be holding it, the election's going to be over before we hold the meeting, if we hold it on the March election, okay? So that's just one thing I want you to think about. Another thing I'll throw out there, if you read the state statute, before the state will basically agree to the city's wishes based upon what it is that the voters decide, the business has to be licensed. I, who take care of all licensing within the city for a majority of things, we do not license cannabis distribution or manufacturing. It happens to be brand new. That will need to go to charter and ordinance, and we'll have to establish some type of business license requirement. So there's a couple hanging chads out here, if we want to call it.
Good recall.
In regards to this, and I just want to make sure that that technically we do it right, because I think Matt has done his due diligence, and from my office's point of view, I'm just passing along information under normal election processes that we would normally follow, and it would just happen normally. But this is an anomaly year. Like I say, we're going to hold our meeting, and we're going to be off almost a full week before we have the election. So when we look at that, it is, and he's probably got that all worked out, but I just wanted to point all those things out. Thank you.
If I could just quickly clarify, so this would actually be a special meeting of the voters of the city. So we're used to them being special meeting of the board, but this is basically, a lot of towns have a town meeting where people come and, sit and listen. We're big enough that it doesn't make sense to do that, so we have, our town meeting is done by Australian ballot, and we do it this way. So in this case, the special meeting is a special meeting of all of the voters of Rutland. So that's why it would take place on as part of the same process as our normal election. It would that's just the technical term to add it to the ballot. And again, I think maybe that language has not been specifically used in the past, and it's just been understood by everybody that what was being voted on was to place it on the general election ballot. But I tried to use the language from the charter today, so that probably is what made it confusing.
Alderman Gillam?
To address the clerk's concern, I have the same concerns. This issue is going to, if you look further down in my report, will remain in committee. Once the people do vote it up or down, okay, if they do vote it up, then the committee needs to put some ordinances in place fees, all those things that need to be addressed. We need to do that before October, so we know we have that much work, but we gotta wait for the vote to figure if it's up or down.
In the control commission.
And the control commission is gonna have to be set up.
Very good, thank you.
Okay, so we did talk about that in committee, and we know that's our next move, so that's why this issue is gonna stay in committee until after the election.
Thank you.
Thank you. Alderman
So are
DePuy?
we on to the final vote as to whether to
Put it on the ballot.
put it on the ballot?
All right, and then we're gonna vote on the verbiage.
And then we're gonna vote on the verbiage, which one you want.
Yep.
To putting it on the ballot. So, Mr. President, inasmuch as I am in favor of this going to the voters of the city of Rutland, so that they can weigh in and have their say on this, and I will vote yes to go to go on the ballot, I would highly encourage the people of the city of Rutland to vote no when this does appear on the ballot on March 1st. I believe
I
it
believe
is.
it is, yes. The first day of March, it is, March 1st, Tuesday, March 1st.
And furthermore, I will be voting no on March 1st for retail sales cannabis in the city of Rutland. But I think it's important that people have a vote on this, and will be voting in favor of allowing them to vote. Thank you.
Thank you. Any further discussion, questions, debate?
If I may, I just think, to the point that Sean Sargent sent a letter as he was unable to attend the meeting, I just think that we should at least let him know that we considered the letter, that we had it, and we read it. And there is one question that he asked, and he said, you know, why is this different than the action we took in 2012? And the reason it's different is because the state has made it legal. And we have to address this question that the state has put out there. So that's the difference. Whether the people in the city agree that they want to see this will come out in a vote. But I think other than that, I'm not sure that many of us have changed their mind, but the state has.
Good. Thank you, Alderman Deuce. Alderman
Can I
Gillam?
speak for the third time?
Yes.
We did talk about that in committee, and I think it's really important that people understand that we have a long ways to go before this actually comes into play. The issue is why it's come to us now, because we have to either opt in or opt out by a time certain. I'd rather us opt in and put the rules in place that we want in the city rule, if it does pass. If the taxpayers put their blessing on it, we should have some control on how we want this set up. That's why this is coming now.
Thank you, Alderman Gillam. Alderman Grusso?
I just want to say that, you know, back to like the Raider vote, our constituents put us here to make decisions for them, and then there are times that I think we have the right to bounce it back to the city voters and let them make the decision. So I support the motions, and what I do in the ballot, in the voting booth, is my business, but I support this motion. I don't think we should deprive the voters of their voice. Thank you.
Thank you, Alderman Grusso. Representative Knott, did you have some?
Thank you. I just wanted to address this briefly. You know, I was on the board when we did not allow medical marijuana in the city. And when we were discussing that, we were discussing 5 or 6 dispensaries throughout the state. This is a very different animal. The legislature has, for all intents and purposes, in the state of Vermont, legalized cannabis. And we could be talking about hundreds of potential retail establishments. I think that a couple things I would want to keep in mind, ask the general public and the Board of Aldermen to keep in mind is, you know, when I was serving on this board with Mayor Lair and Tom and Sharon, we banned fireworks sales in the city. We wouldn't allow that to go forward. I can walk from Rutland city limits to the nearest fireworks store in about 2 minutes, and I don't walk fast in my old age. So this is a situation where you could not put it on the ballot, but there's going to be a store in Rutland Town or in Mendon or somewhere nearby, and this is going to be here. And I know one other concern that I heard, and this has been shared by numerous people, and I believe Commissioner Sargent mentioned it, is that there's no roadside test. And as I mentioned, this issue spent a lot of time in the committee I serve in the legislature, the Judiciary Committee, and particularly the saliva test. The governor very much wanted a saliva test as part of passing this bill, passing this law. And at the end of the day, he had to let that go. And it's not because he cared less about safety as the thing went on. That's far from that. It's because, quite simply, this test doesn't exist. There are saliva tests, but all the existing saliva tests can do is confirm whether or not someone has used cannabis in the last 2 months. It doesn't show impairment. It's just, quite frankly, an invasion of privacy on whether or not someone has used a legal substance. So that does not work. I heard concern expressed, and I share this concern, that Rutland City only has one impairment expert right now. And that is a big concern. But that will be a big concern whether cannabis retail is legalized in Rutland City or not. Because people are already driving out of state to consume it. They will drive 5 miles, 10 miles, and they'll have this product. And so if we're concerned about impaired drivers, I would strongly encourage Rutland City to allow retail cannabis so that we have the additional revenue from taxes and whatnot, so that we can make certain that our police department is as trained as possible. And I think it was very enlightening for me. The House Judiciary Committee had the opportunity to view a state trooper who's trained as a impairment expert. And it was really fascinating, and it is a science, and it works. So I would certainly encourage this board to, not swim against the tide. This is going to be in our area. Let's have it in Rutland City. Let's allow it in Rutland City so we can capture those tax dollars, and we can make certain that our police department is as prepared as possible for increased usage and any challenges that come with it. Because it's going to be here. If not in city limits, very, very close.
Thank you, Alderman
I
DePoy.
have a quick question for you. Did the state legislature decriminalize or did it legalize? Because there's a difference. Decriminalization means they're just not going to prosecute. The PDs aren't going to go out and look for it to make busts. But if it's legalized, then we're talking a different animal. And as it's stated in Sergeant's memo, it's also still illegal at the federal level. And did you have those conversations as to whether the federal law trumps state law, whatever it is that you did, whether decriminalization or legalization? What do you do about the feds at the state level who might want to come in and make a pot bust?
And that's a fair question, and that's something that a lot of states, in addition to ours, are working out. As far as legalization or decriminalization, quite frankly, it's an odd hybrid, because you can have what is considered a recreational amount of cannabis. But if you are driving around with, a trunk full, then you're still violating the law. And it's going to be like alcohol. You can have you can have a beer, but you can't show up with a bunch of cases and start selling it if you don't have your license. So it is a bit of a hybrid, and it's partially a bit of a hybrid because it is still illegal at the federal level, and it doesn't look like that's going to change anytime soon. So yeah, there is some issue, and we did hear some concerns expressed at the state police level in regards to that. And we are looking with interest at states that have legalized earlier and see how that's playing out. But the only honest answer is that it's a work in progress, because it is very unusual for the states to, in effect, turn their back on federal law. But that's what's happened in a number of states so far. And to this point, the federal government, whether it's under the current administration or the previous one, has not really pushed back on that.
Thank you. All right, so we have a motion, and it has been seconded. It is to place this question of retail cannabis on the March ballot, and it shall be a binding question. There's no further discussion, debate, or questions on this. Would all those in favor please say aye?
Aye.
Those opposed, motion carries. Alderman Gillam.
So now we need to figure out which one we want on. So I'll let the city attorney tell us what this is. These
If
two
I may,
options.
I'll try to simplify the email that I sent earlier today, and then I printed out hard copies for you all. So
Are you working
the,
off your memo right now?
I'm looking at the email that I printed from 9/24 this morning.
Okay.
So the gist is that the legislature, when they allowed this to be an opt-in, they allowed cities to vote on whether they were opting in to allow either cannabis retailers or the retail portion of integrated licensees. So the board has to make the decision of whether they're going to put on the ballot a question about one or both of those entities, whether City of Rutland would permit cannabis retailers or the retail portion of an integrated licensee. And if you decide that you want to put it to the voters to allow both of those, do you want to put it in one question, or do you want to put it in separate questions so that one could be potentially voted up and one could be voted down? And then there's a second level of after that, but that's probably easier to start with that question.
And I'll be happy to step outside the rail as far as that goes, because I believe this is a legitimate question. Whatever you folks do, I'll strongly support. You have to think about the voter. When they read this question, are they going to understand what it is you're asking of them?
That's exactly what
Because we get this a lot, and I'm not saying there's some simple folk out there that just don't quite understand. So when we're looking at this, if you really are bringing in the details, there's going to be a lot of stuff. I had you work the polls, my friend, kind of what we're able to and not able to do. Back in the day, you cannot guide, a voter with anything. You can kind of explain it to them, but they have to make up their own mind. So all I'm stating is, whatever you folks decide to do, simplicity is best when it comes to a ballot question. Thank you, and I appreciate it.
Absolutely. I saw Alderman Dunges, then
So from my understanding, the one question mode essentially allows all retail sales, regardless of whether it's just a retail or a retail and a manufacturer grower.
Correct.
The second option, just for everybody, is to separate whether just retailers or retail growers get the right. I think to the point of complication versus simplicity, I think in a community that's our size, where there's only so many locations you can grow with inside the city limits, I don't think it's worth confusing the voters with two questions. I think one question simplifies the process and gets us the answer that we want. So I'm going to recommend that we use number one with the effective date.
Yes.
I'll make a motion even to use number one with the effective date.
Second.
With the second, with the effective date. I'm just, if I may, I'm sorry, somebody's probably ahead of me. No, somebody. So, so in the retail portion of an integrated licensee, do you think that's clear? I don't know. To Henry's point?
I mean, that's what the language from the state is.
Okay.
I mean, the problem is, just to kind of take it to the extreme, we've got to have something that, legally works too. So we can't just say, like, can we sell weed in Rutland City? It's got to have some bearing on that would be the most simple for the voters, but I'm not sure that the powers that be in the legislature would see that as the correct opt-in language. So, if it helps, we could have copies of this 7 VSA 861 so people can see how an integrated licensee is defined. But it is, a larger business that does growing and cultivating and everything under the sun. So it'd be, a larger business that's doing all those things and then has a retail shop to sell what they've been growing versus, I think, what Josh and Anna are proposing. They would be considered a cannabis retailer who's getting their product from other businesses, and they're just the retailer, not having anything to do with the supply chain before that. So those are the two kind of that can be permitted. Is you could permit just the Josh and Anna's that are getting their product from someplace else and just have a retail store, or you can also permit the retail portion of the integrated licensee, because you can't block an integrated licensee from operating and doing those other things in city limits, but you could decide not to allow them to sell, not to put the vote to the voters, to allow them to sell the retail portion.
So I just have one other quick question. So if this passes, and retail is establishing, is there guidance as to where they can and cannot locate?
As of right now, I don't know for sure, but I think you would want to have something referred to committee so that you could get with Andrew.
Right.
And try to decide, believe what they do is, I wish he was here, he would articulate it better, but if there's a business that comes into Rutland and it's not clearly defined within the zoning regulations, they try to find the closest definition, and then that is then used. So there's probably something with just a regular retail store where those are allowed. So if we don't amend the zoning regulations to specifically have a definition for cannabis retail, it would likely fall into wherever any other retail can be located. So if the board does want to limit where it may be.
We could pick the zone, we could pick the zone in the process.
Yep.
I would grab my hand up a couple times. How important is it we have to do this tonight?
Because we have to get it on the ballot, so it's
I
gonna.
understand, but isn't that usually January?
Yeah, we have until, Henry could speak better to when the final language needs to be delivered to him, but I believe it's not tonight, it's in
I
January.
just, I'll admit, I've been sick and I had now a death in the family, and I haven't really put much time in this, and I apologize I haven't been able to go to the committee meetings because of the health issue, but, I think a couple of weeks wouldn't hurt, and let us all learn more about this and understand it. I didn't know what an integrated license was before the city attorney mentioned it, and I don't see a big deal. Another couple of weeks isn't gonna give us time and maybe community feedback like we got tonight on the mask issue.
Okay. Take a look at
Table for 2 weeks, motion to table?
Second.
All right, so motion to table, it's been seconded,
There's already an open motion on the floor. Do we have to vote on that motion
Higher.
first?
Motion tables higher.
Yeah,
Table takes
table takes
precedence.
precedent.
So tabling takes precedence, so we have to vote on that now. There's a motion to table, it's been seconded, non-debatable. So all those in favor of tabling this until the following meeting, please indicate by saying aye.
Aye.
Those opposed?
No.
Motion fails. All right, so we're back to the original motion, which was that we would adopt the first question stated on the recommendation, the single
With the
question.
effective date.
With what, sorry, so
With the effective date.
with the effective date. Attorney Bloomer.
So if anybody would like, I could talk about why the distinction between having an effective date and not. But if everybody's already
we're
read, and,
Unless somebody else has a question, I think we're good.
okay.
I think we're okay. So is there any further discussion on that motion? If not, we have a motion that's been seconded to adopt the single question with the effective date. Would all those in favor, Attorney Bloomer?
If I may, I think it should be done in the form of the last
Okay.
entry
I will-
in the,
I'll amend the motion to say, motion to petition the mayor to call a special meeting on town meeting day in 2022 for the following question. Shall the city of Rutland permit the operation of cannabis retailers and the retail portion of an integrated licensee within the city as such terms are defined within 7 VSA 861, beginning in October of 2022 and subject to state law and any city ordinances or regulations that the city may lawfully adopt?
Second.
Second.
Okay.
All right, so the motion's been seconded. So this is actually an amendment to the original motion. So would all those in favor of the amendment to the original motion, please say aye.
Aye.
Those opposed, motion carries. So the full motion, everything now is on the table. With all those in favor,
I just want to make sure. So this special meeting that they've gone and approved.
Yep.
So we would have until about somewhere between the 21st and 25th of January to finalize everything. Warning is the first thing. The candidates' petitions are the last thing to come in, Sam, as far as that goes. So that's the last. That Monday they come in, Wednesday they got the drop dead date. That's it. After that, we're done, because the actual warning has to be posted that Friday, okay? So, will we have the language to this ballot question?
We'll have it tonight, we'll have it in 30 seconds.
Okay.
If all goes well.
So that can be posted on the warning, so we would be
And
good
this
to,
is-
and it'd be built into the ballot, so we're all set. So whatever the meeting's gonna be held, it's not gonna hold that up.
The
meeting is
the meeting
voting
is
day.
gonna be held,
The meeting
yeah,
is
the
the
meeting
vote.
is the general election.
General
It's the
election.
vote.
It's just the
It's
old
the-
school language.
Yeah, it's
that
the
we're confused.
terminology that I'm using that I think is.
Quite conceptual.
We're so used to having that public hearing prior to
Correct.
ballot items.
Correct.
Simultaneously on a single day.
Okay.
Okay,
Metaverse.
so we have a motion. It's been seconded, as amended. Would all those in favor please say aye? Aye. Those opposed, motion carries.
Nice work.
I need to finish the committee report now. So, the issue will remain in committee due to the outcome of the public vote. We will definitely have to work on some ordinances to put in place, you know, special
Licensing.
licensing requirements and a board and the whole 9 yards. So, you know, because the people vote on, we still got a long ways to go before we get to October. So, the meeting adjourned at 6:17, and that's the end of my report. Thank you very much.
Thank you very much, Alderman Gillam. All right, this brings us to reports of select committees. There are none. Reports of representatives, there is nothing. We've already done petitions, letters, miscellaneous communication. Board of Control Commissioners, we have nothing. Is there any unfinished business to come before the board? Seeing none. This brings us to miscellaneous motions, resolutions, new business.
We have the 33 Summer Street.
Oh, right.
Lease.
Attorney Bloomer.
Is that executive session?
No, it doesn't need to be executive session. We have another property that has tenants within the property. So we've had similar conversations about this in executive session, and we could go into executive session if you'd like. But if everybody's comfortable, we just need authorization to offer leases to those tenants. And so the motion that I would be looking for is a mirror image of what you approved previously. It's a motion to authorize the planning and zoning administrator to negotiate a lease with each of the various tenants of 33 Summer Street on terms including rental amounts that the administrator deems appropriate, using a lease in substantially the form previously authorized by the board, and further authorizing the mayor to sign and enter into such negotiated leases on behalf of the city.
I'll move to suspend the rules.
Second.
A motion to suspend the rules has been seconded. Would all those in favor please say aye?
Aye.
Those opposed, motion carries.
Approve the motion as read by the city attorney.
Second.
We have a motion, it's been seconded. Is there any questions, discussion, debate? Hearing and seeing none. Would all those in favor please say aye?
Aye.
Those opposed, motion carries. We're still under miscellaneous motions, resolutions, new business.
I'll move to go into executive session.
Alderman Leary, did you have something real quick?
Well, there's this paper we have here from, you referred
It's
it?
information only.
Well, there's a request for $250 to support 2022 NRDC, or NRCD. I'll make a motion to approve the $250 contribution to, well, no, it's gotta be, sorry, motion to suspend the rules.
Second.
A motion to suspend the rules has been seconded. Would all those in favor please say aye?
Aye.
Those opposed, motion carries. Alderman Leary.
Motion to fulfill the request from Rutland Natural Resource Conservation District to approve a $250 contribution to support the 2022 program.
I heard a second. Okay, we have a motion. It has been seconded.
Who seconded?
Carrie did. Or Alderman Sullivan.
Do we need to identify the funding source?
That was what I was gonna ask.
All right, who would like to,
And a 9 whistle.
Yeah, is there change laying around for this?
Bottle drive.
Yeah, what's the prerogative? I think these are normal dues for the NRCD.
Do we have, I don't know that we have dues to, I've never, this is new. This request is new. I've never seen a request from this, and that's why I was just kind of reading some of the things with the phosphorus and blah, blah, blah. I think I'd like to refer it to the Public Works, to you? I'll refer it to the mayor.
Second.
Yes.
All right, so I have a motion to refer to the mayor, it's been seconded. Yeah, so all those in favor of referring this issue to the mayor for further investigation, please indicate by saying aye.
Aye.
Those opposed, motion carries. Is there any other miscellaneous motions, resolutions, new business before executive session? Hearing and seeing none. I'll entertain language, Attorney Bloomer.
Motion to find that premature general public knowledge regarding pending litigation to which city is a party would clearly place the city at a substantial disadvantage because the discussion will divulge the city's strategy in such pending litigation and will include confidential attorney-client communications made for the purpose of providing professional legal services to the city.
So moved.
Second.
All right, we have a motion, it's been seconded. Would all those in favor, please say aye. Aye. Those opposed, motion carries. Attorney Bloomer.
Motion to enter into executive session with the inclusion of the
I like the Mickey Mouse code.
clerk, mayor, and city attorney to discuss pending litigation as allowed under Title I, Section 313A1E and Title I, Section 313A1F.
So moved.
Second.
We have a motion, it's been seconded. Would all those in favor, please say aye. Aye. Those opposed? We will stand down and we're going to enter into executive session.